Hello, my name is Stephanie, and today we're going to talk about Hutchinson-Gilford progeria syndrome, or it's also known as just simply progeria. Progeria is an extremely rare progressive genetic disorder. It manifests as a rapid aging in children. It was discovered in England in the 19th century, and it is due to a genetic mutation during conception. There is no known cure, but there is a drug that is being used in case studies that will hopefully help these children who have progeria. And then we have two pictures. The one on the left is 3 children that were at a survival benefits, and then the one on the right is a girl with progeria on her 17th birthday. The symptoms: children with progeria do not start to show symptoms until they're about 2 years old. They're born completely normal. After 2 years old, they start showing the symptoms, which are, they have very similar symptoms. Same facial features. They're pretty small compared to the size of their head. They often have bulging eyes, a small jaw, pinched nose or beak-like nose. They have alopecia, which is a lack of hair. They usually don't have hair on their heads or eyebrows or eyelashes. They tend to look like little elderly people. They also have internal similarities as well. They are often very small in height and weight due to their underdeveloped skeletons. They are prone to hip dislocation, stiff joints, and have very minimal muscle mass and very thin skin. The pathophysiology of this disease, the cause of progeria is due to a point mutation of the coding of the LMNA gene. The LMNA gene provides instructions for making several proteins, and these proteins are called lamins. The LMNA gene produces or provides instructions for lamin A and lamin C. It is the lamin A that is affected. Lamin A, when it's mutated, it produces progerin, is what it's called, and hence where progeria gets its name from. The shape of the nucleus of the cell is what lamin A determines. And when that's mutated, it messes everything up. The shape of the nucleus of the cell is extremely important for proper growth, development, and repair of the cell. This progerin makes the cell unstable and in turn leads to a premature death of the cell. This is believed to be the cause of the rapid aging in both the physical and appearance in these children. The diagnosis and course of this disease is often not tested for because it is so extremely rare. It affects only 1 in 20 million people, and it affects all genders and all races equally. The graph above, that's just showing that it says 179 known children with progeria living around the world as of September of 2020. So it's not very many in the grand scheme of things. The tests are usually started after 2 years old when they start showing symptoms. The most common imaging modalities for suspected progeria are often X-ray and CT, and this is just the best way to look at the bones because that's really the dead giveaway. The only way to really confirm this disease is by genetic testing to check out the cells and see if they've been mutated. Physicians, after the children have been diagnosed, the physicians will monitor their height, weight, hearing, vision, blood pressure, heart, and circulatory health throughout the child's life. On average, children with progeria die around 13. However, some have lived to their 20s, but they don't often live very long. The main cause of death is usually arteriosclerosis, which is the hardening of the arteries. which in turn leads to cardiovascular disease, also known as heart disease, which is when blood vessels are narrowed or blocked, causing heart attacks and strokes. And unfortunately, that's most of the time how these children die. On the bottom here, we have, to the left, are CT scans of a child with progeria, and then on the right is a normal skull. And then to the right of that is an X-ray of a lateral skull with a child with progeria. Some treatments and support. There's not a lot of treatments because there is no cure. The treatments are often just symptomatic. These treatments focus on managing symptoms and increase patients' comfort with hopes to slow the progression of the disease. Physical and nutritional therapies are key, along with some other over-the-counter medications to help with pain, lower cholesterol, anticoagulants, and sometimes even growth hormones. Counseling and professional guidance is strongly recommended to help the child and their families navigate through such a traumatic disease. There are even online support groups where the children can meet other children like them, which is very helpful. For these children, doing as many activities as normal children do at their age helps immensely. Even something as simple as wearing a wig can help boost their spirits. And we have a picture of a little girl who is wearing a wig with her mom and makes her feel better. Then we have a case study that was recently done in 2018. It was performed using a medication called lonafarnib. Lonafarnib was originally used as a cancer drug, but was found to help with weight gain and increase flexibility of the blood vessels, which would be a great thing for these children with progeria. This case study compared a group of untreated patients with progeria to two groups of patients that were treated with the lonafarnib. There were about 258 patients in all, 123 females, 135 males. Within the untreated group, these patients received no clinical medications whatsoever. The first treated group were treated with only lonafarnib. The second group were treated with lonafarnib along with a combination of other medications. The duration of the trial was about 2 years. Unfortunately, the primary cause of death for these children was heart failure, which is usually seen with children with progeria. But it was shown the treatment with lonafarnib was associated with significant lower mortality rates. So these children ended up living longer than expected, which is awesome. There's still no cure for progeria, but nothing has come this close to helping these children, which is a very exciting thing. Thank you so much, and have a wonderful day.